Welcome to Mouth Matters with Dr. Dom, with me, Dominic Lombardi, aka Dom, and for your purposes, I guess, Dr. Dom. I wanted a way, ever since I've started interacting with patients, to give people a real-life approach to dentistry and their oral health without the fear and anxiety of coming into a dental office and worrying about how much something's going to cost you, and we can get down to just the nuts and bolts of what it takes to be healthy. So here we are, our first show. I'm with the gentleman who actually gave me the inspiration to do this. His name is Mark Riccadonna. He's sitting right here, beautiful curly locks.
Yes.
Mark is a comedian by trade,
Yeah.
along with being a writer and an avid enthusiast of oral health.
Yes, well, since I met you,
he was a mess.
I was a mess before. You wouldn't even believe it.
Just kidding. It was fun.
I think this is an important show because it allows people to get to know you so they can come in and be comfortable. But I also think it's cool that you're willing to give some tips and some ideas. Because, like, for me, what's the worst thing I can do, like coffee, wine, all these things that you hear about? What's the worst thing to drink?
It's more of what you do, how you drink it, and how often you drink it. So I'm a self-proclaimed coffee addict. I go through, I don't like admitting this, but between 3 and 8 cups a day as far as my coffee consumption goes.
Oh,
now
that's low.
It's my heart rate right now is about 110. That's baseline.
I like to keep it there. Then I feel like I'm an athlete.
Well, you're doing cardio right now. We're the standstill treadmill. But Mark, it's about after you drink the coffee. Let's rinse with water. Let's make sure that we're not letting it sit on there. If we use sweetener, sugar. I really, as you might think.
Does sugar really rot your teeth?
Believe it or not, yes. But you need that bacteria in your mouth and the time sitting on it. So if we have, say you like sugar, let's take this as a caveat. The sugar itself, if you just drink it and then wash it away, isn't going to hurt you. But if you leave it sit, that bacteria combined with the sugar and then the time is what brings that Venn diagram of all those factors together to create dental decay. And
I always thought it was a way just to get my kids to stop eating sugar.
Well, when they come and see me and the needle comes out, that's another way to get them to crack down too. But as you'll see in this show, I'm going to highlight how you got to live. If you go into life, you're saying, "Oh, I can't have that. I can't have that. I can't have that." Then you're always going to be on the edge, and you're going to end up messing up in the end anyway because you're going to think that real health isn't a feat that's attainable. So back to your original question: coffee, tea, wine. To really answer the question, tea stains your teeth the worst. The pigment in the tea is more aggressive at being taken up by the tooth.
So is this why the stereotype of British people with bad teeth is because of all the tea toting they're doing?
I have to tell you that I've never really thought about that, but your beautiful mind you may be onto something. So Mark and I, just to kind of give you a little glimpse into our relationship, we've known each other for a long time. His mother cuts my hair. She does a fabulous job. I think I'm due right now. But he was always, he moved to New York City when, how old were you? 17 years old. So tell us a little bit about the difference between here in the Shenango Valley.
Well, just today I was going to do radio in Akron, and as I was driving through on my GPS in Ravenna, downtown Ravenna, was red.
D-Town our town. D-Town our town.
And so I'm going, oh my God, there must be a big traffic jam in Ravenna. It was actually a case of beer fell out of somebody's car and splattered all over. And now it was a solid red on the GPS because it was a disaster. There's spilled beer.
It's like an oil spill.
I was expecting, 20 minutes backup because of traffic or something. But it was weird. I mean, you know where I live and where I grew up. It went from farm to city. And, I really liked it. I like both. That's the thing. Like, you gotta love everything, right?
And there's a little bit of balance.
Yeah, you gotta
Right
have the
there, too.
balance, you know.
That's like for me, you know, I to give you a little background on myself.
Yeah, I was about to say you travel quite a bit with your.
Well, to start with, it was, you know, my first experience not living here was school. Obviously, I went to undergraduate in Erie, Pennsylvania, which is pretty similar to where we are now. But then for dental school, I went to school in Sarasota, Florida, and you know that gave me another glimpse into
an appreciation for air conditioning.
Yes, but it turned me into a wuss when I moved back. That was the problem because it was Thanksgiving. It was 45 degrees, and I'm over here shivering like an old lady or something. But yeah, and I wasn't ashamed at all because it was like chatterbox time, you know. But getting back to my experiences in school and stuff, I feel like you should know about me a little bit professionally. The dental school experience of treating people who don't necessarily have what we have or aren't as fortunate, that kind of gives you a wake-up call as to, wow, if we don't take care of ourselves, this is a big deal. You know, we're talking about, and we'll highlight this in further episodes. And if you guys ever have any questions, you're more than welcome to contact me through any of our outlets that you'll see on our promos and stuff like that. But you know, you're talking about bacteria getting in the bloodstream. You're talking about tooth loss that can happen rapidly if you let yourself get to a state where there's really
infections.
You're talking about periodontal disease, and this is stuff that can affect anybody. You know, this isn't like you have to be disabled, or you don't. It's not you have to have like you don't brush your teeth at all, or something like that. If you don't consult a professional, you know, there's a chance that you have something going on. You know, and that's the beauty of what I like is I give people a preventative plan, and then I want to give you the knowledge and the resources to actually ask the right questions to your dentist. Obviously, I know that everybody isn't going to be coming to Sharpsville, Pennsylvania to see me. But you should. It's worth the plane flight and the expense, and we'll get you up at a hotel at a discounted rate, of course. But just like Mark.
Well, here's the thing too: is I'll be your guide for your stupid questions. You feel like you have a stupid question, I'll be the one to ask, because every question I ask is stupid. Most people say there's no such thing as a stupid question. Those are people who haven't met me.
Mark, I feel like if it was written down, it wouldn't be stupid, but maybe maybe it's your delivery. I don't know. Mark is brilliant. I don't never want any disparaging comments towards my friend. Comedy, they say, is the best form of intelligence to display.
Thank you.
Actually, I never heard that. I just made that up. But
I believe you. Here's a question. I've noticed over the years my gums get higher.
Yeah, so
do they come back down eventually? Do we have to talk them down? What do we do?
I wish we could. What happens when you get gum?
We're gonna have to rinse after that.
That's right. There should be a water bottle right here too. What happens is gums can recede. Basically, if you're more prone to it genetically, which I am, I'll show you my receding gums if you really want to see them. But
we might have to rate this for mature
That's
audiences.
right. This isn't a horror film. But no, usually it's because of brushing and bad brushing habits. You know, if you're using a toothbrush that's too hard, if you're doing this sideways motion as opposed to the circular motion, and I kind of think that the circular motion is almost unreasonable to try to get people to brush like that. You know, it's even hard for me. Like, I have good dexterity. You know,
that's your
living. I better, right? Can't come in like that. But as far as that technique, that's why I love electric toothbrushes. You know, my favorite is a Sonicare toothbrush. That way, instead of having to brush per se, you just move the brush head around. And the Sonicare, and believe it or not, I don't get compensated by Philips Sonicare in any way.
Unless they want
to. Do you hear me, executives of America? But you just hold the brush where you need it, and then the bristles themselves remove the biofilm, which is the plaque. And their claim is that it will remove the plaque, the biofilm, up to 4 millimeters away from the bristle tip. So if you're not the best brusher, which all of us have deficits in some part of our mouth where we don't get it as well as we should, that is a great way to kind of make that a little bit more effective for you. You know, in between your 6-month cleanings, of course.
So my kids have a toothbrush that lights up and tells you when to switch sides.
I love it.
Is that something an adult should think about?
Well, actually, in the Sonicares and even in the Oral-B's, pretty much any higher end electric toothbrush, you know, somewhere starting around the $50 range, maybe even $40 range, is going to have that little buzz function. Like it won't light up or sing you a song like the kids one will, unless you want to just use a kids one, because that works just as well.
That's my next question.
Yeah, it'll be. How did I know?
Can I get one that plays like Metallica songs while I'm brushing?
Yeah, but what it is and you know, I'm guilty of this. Like it'll buzz, and then I'll just keep staying in that spot because I'm a freak and like brush my teeth too much.
Well, that's why your teeth are white and mine are off white.
Well, Mark, you know, I like to think of it as adding character. You know, we
so my gray hair, my gray teeth,
salt and pepper. I'm telling you, that's like you're like a plus size George Clooney.
There you go. I'll take that. Basically, you're saying Danny DeVito.
It's an amalgamation of sorts. But no, but to continue with the question, it is nice. It lets you know. Yeah. You know, the less guesswork, the better. And we'll go over, you know, I'm getting into this now, but we'll go over toothpaste, mouth rinses, the ones you want to use, when you want to use it, and you know, it's kind of cool because this is stuff you can do to make a real change in your life.
So something that I had a dentist question.
Sure.
When we met with Dr. Oz, he was telling us about how most surgeons retire because of age. You know, they don't have that precision with their hands. They steady as can be.
Sure.
The minute they lose that, is that so? Like surgeons tend to retire at a certain age because they lose that precision with their hands. Dentistry the same?
Well, they also make more than dentists, so there's another reason they retire.
There's a little more cushion.
Yeah, there's another reason they retire early, but there is some of that. You know, and everybody ages differently. You know, the gentleman I bought the practice off of, Dr. McCammett, he just retired. You know, officially, he's 71 years old. And in watching him work, you know, was he as steady as he was when he was my age? Probably not. But there are techniques that we use to maintain our stability.
That's mostly like
right. So, like, I'm not going in there just holding it. I'm not just holding the drill freehand. Like if you notice when you're at the dentist or even when your hygienist is cleaning your teeth, they're resting their fingers in certain places to make sure that they're stable, and that way they don't zip your tongue or your cheek.
I'm usually closing my eyes as tight as possible, holding under the chair like this. So I'll try to pay more attention next time.
A few beads of sweat coming down.
I lose weight every time I go to the dentist. I sweat.
But then I give you a cookie when you leave too, to just gain it back. That once again into my theme of making sure that you know you can live and eat and enjoy yourself. But
by the way, my kids are obsessed with your cookies. Every single time we come to Ohio, do we get a tooth cookie?
That's, you know, there is something to it.
You might have to open a bakery.
Sugar is a drug.
I got 2 addicts at home.
The most addictive, and we don't like withdrawals. I'd imagine that they're not the most fun to be around when they're coming down. They're sweet kids. But no, back to, you know, when it's time for someone to retire. I think it's more about when you lose your passion, you know, or when you come in and, you know, you aren't stimulated as much anymore, or you just want to do something else. You know, I know for Dr. McCammett, it was about spending more time with his family and his grandkids, and you know, I'm a little jealous because I kind of liked having them there to talk to all day long in between patients. But
you got to split time with the grandkids now.
But you know what? Another thing is, in seriousness, is that when you get up in age and you're ready to retire, you may not want to invest in all the technology that it takes to be you know, to be relevant. You know, when you look at even just our X-ray sensor for our digital X-rays is $10,000. You know, and then you're doing that. You're making sure
you're making a couple more years. You might not want to make that big of an investment.
Right, and if you aren't using that, then you're cutting the patient short. And you know, we could get more into that and everything, and I'll show you all the stuff that we have in further episodes, technology wise. But I just want to say I'm so excited that we got this going.
This is the inaugural podcast. I think we need to break some champagne.
This day in history, year of our Lord 2018.
We're going to erect a statue in 20 years of you in the dentist drill.
I don't know about that. I think you would be a better silhouette to see coming down the road.
People are going to think it's Jackie Gleason.
I'll feel the De Niro move. I don't know. But, thanks, guys. I appreciate it. I can't wait to talk to you more and hear more of what you want to know about. And if there's anything you want to know about me, I'm an open book. So I appreciate it. Thank you so much.